globulus. Okay, so primitive times. We're going to be talking about, we're just starting from way back at the beginning, and we're going to work all the way up to today as we go through this lecture. It's kind of a longer lecture, if you will, so it'll take a few days to go over it all, but it's pretty interesting. I think you'll find it really interesting. Okay, so primitive times. Illness and disease were a punishment from the gods. That's what was believed. So what do we know that causes illness and disease?
Germs and bacteria.
Germs, bacteria, right? Bacteria, viruses, or maybe things that we take into our body that are toxic to us, aren't necessarily something living like those, but can still be detrimental. I was listening to a podcast today, and the guy was talking about an article he had read about this community in South Texas that was built basically on a toxic waste dump, but didn't realize it. And so over time, as the river that was nearby eroded, it brought in all this toxic waste. And so there's been a high incidence of cancers, tumors, and other like long-term diseases that people have gotten, for that reason, that they're bathing in and drinking this water that was a toxic waste dump, So, we know those things today, but there's a reason. When you get sick, if you lick the desktop in here, you're probably going to get sick because everybody's had their face on it and their hands on it. People don't wash their hands when they go to the bathroom.
Well, we haven't had soap in the girls' bathroom for since the beginning of school.
Well, I will get that fixed. So,
and we've told people
maybe it's not even working sometimes. I'll find out. Okay, so tribal witch doctors treated illness with ceremonies. A lot of times they'd have a ceremony to make something better, And there's still witch doctors. I've met a couple of witch doctors in my travels, and so they're pretty creepy.
I don't think their methods work.
Do what?
I don't think their methods work.
No, but sometimes they work in ways you don't want them to work, and they can make people sicker or make them have some issues, But it's a very manipulating kind of position, the witch doctors, at least the ones that I've seen and met and have worked with people who have gone to see witch doctors, It's scary. But anyway, so this time that's what, it would be a special person. And herbs and plants are used as medicine. So 2 examples is morphine. Have y'all heard of morphine before?
Yes.
Or what?
It's a pain medication.
Pain medicine, okay? And it comes from a flower. It's called the opium poppy. And morphine is in the same class of drugs as opiates, like the illegal drugs, opiate, like opium. It's the same classification. Okay, so that's an example, the opium poppy, so they could eat that or they might mix it in with something else and take it. Now that's kind of scary to think about because who knows how much you're getting. If you take too much morphine, okay, it can depress your lungs and your breathing to the point that you will stop breathing. If you overdose on it, that's what it does. Okay, digitalis is another example. It comes from the foxglove plant, and it actually slows down your heart rate. A lot of people who have heart trouble, like abnormal rhythms, they'll take digitalis or digoxin. The name of that medicine is very potent heart medicine that you have to watch them really carefully. People who take it, they have to take every 3 months, usually 3 months, I guess, they get blood work or make sure it's not at toxic levels in their blood because it can get that and cause some other long-term problems. So it's both of these 2 medications, even today, are very potent medications that carry a lot of, risks with them. So you think about then, how are they going to measure it out and know exactly how much a person is getting? They don't, right? Kind of scary. Trepanation or trepanning, which is surgically removing a piece of bone from the skull. So somebody had, especially people had like mental disease, mental illness, or something, or maybe they had a head injury and something else was going on. They would remove a part of their skull, I guess, to let pressure out, but thinking that would cure them, or drill a hole through their skull, and that would let out like a bad spirit or something like that. And remember, anesthesia wasn't created or wasn't discovered until 1800, I think it was. It'll go over it around here. Average lifespan was 20 years. What does that mean?
That they normally lived only to be 20.
Good thoughts, but that's not necessarily true. It doesn't mean that everybody only lived to be 20 and then they died.
That's just the
Okay.
average.
That's the average. And so what brings down an average lifespan, would you think?
Healthcare.
Okay. It's an average. Your lifespan ends at death, right? So basically this is an average kind of age of death. That's what you got to think of. There are probably lots of babies at this point that died, right? Because sickness, newborn babies are pretty fragile anyways. And you think about hand washing was not a thing yet. They didn't know what caused, they didn't realize bacteria was causing disease and illness. So lots of babies died. Probably a lot died in childbirth as well. So you think about that, that really pulls that average lifespan down. Doesn't mean that everybody only lived to 20. It just means that the average death was about 20. So you had lots of babies and kids that died from sickness, illness, injury, whatever. And then you have people that are living to be older. Okay, ancient Egypt. We'll try to get through ancient Egypt today. So long time period we're looking at here. And of course, over that time period, you get more, they would get more and more sophisticated in the things that they do. But embalming itself was done by special priests. What is embalming?
You basically take all the organs and blood out of a dead person and replace it with fluid.
Right. So when somebody dies, they had this whole process that they went to. They put things in canopic jars. And they put things in canopic jars and had embalming. So they wrap the bodies up, right, in with gauze and other things that they use. Just same way we do today. We embalm today. We use special fluids and they wrap the bodies and things. So, well, I don't think they wrap them today, but they did that. Advanced knowledge of anatomy, right? So these priests who are taking out these organs, they're going to know a lot about anatomy because they're taking them out. They're figuring it out as they go. Strong antiseptics were used to prevent decay. And that's why we see, like you go to the museum or something and you read about like the fact that, we hear about mummies. Well, that mummification process that they used was very effective. Even today, when they found mummies and their skin, even it's still intact. Okay. Gauze, they used gauze that was really similar to today's gauze. And the way that gauze works is it has this like wicking sense to it, and you can feel it.
I think it was the back one. That's the back one.
So you can feel, of course, not that other part. Pass that around. But that gauze has this like wicking way. So if you put that in a wound, it actually draws out blood and draws out, whatever's in the wound. It's going to draw it out. So that's the same. It kind of has this drying effect. That's why if you put it on, like if you have an abrasion or a cut, what happens if you put that kind of gauze on there? It sticks to it, right? And you pull it off, it usually starts bleeding again because that blood clot has adhered to that gauze. The same idea. So it's a good kind of pulls fluid out, dries it out. Okay, physicians were priests. So they were separate priests from the embalming priests, but that's what they did. They worked with that. Bloodletting or leeches were used as medical treatment. So if somebody had a blood disease or if they had something going on, they would attach leeches to them or maybe cut them and let blood out, thinking that would kind of clean them out, if you will. Now, leeches are still used. I had a guy, when my very first guy we were starting IV on, poor guy, had cut his finger, actually not just cut it, it had like separated from his hand. he was working in a factory or, like an industrial kind of place, and he had swung off of a bar to get down off of something. He just grabbed a bar. I don't know if he was getting out of a forklift, it seems, or something like that. Grabbed onto a bar and kind of swung out to get down. And when he did, his wedding ring caught a bolt that was sticking up. When it did that, it stretched out his wedding ring. It looked like, it was like oval shape. And it basically took his whole finger off with it. It like cut all the way down to the bone, took his whole finger off. So when he came in, he just had some bones sticking up. That was it. So all of his skin and muscle was gone. Well, they had done surgery and reattached everything. Reattached the bone, they did microsurgery where they reattached his blood vessels. And anyways, they were using leeches on the end of his finger. And what those leeches do is they pull blood up through that new freshly attached finger. And that helps. Blood carries what? What's blood carry?
Vitamins, oxygen.
Oxygen, right? And so your skin and tissues need oxygen in order to function and to carry on and multiply. So that's why they put those leeches on there, pulled blood up there, which gave it oxygen. Isn't that cool?
Wait, in modern hospitals?
Yeah, this is like when I was in nursing school. Isn't that cool? They still use leeches. They're used a lot.
Was there a whole